Welcome to the online training for Hawaii's school-located influenza vaccination program, also known as Stop Flu at School. The following slides provide information to prepare staff for their roles and responsibilities at the clinics. Completion of this training and a passing score on the post-test are required for all Stop Flu at School personnel prior to their participation in a clinic. Clinic personnel must pass the post-test with at least a 70% score. If a course participant does not pass within 3 attempts, then they will not be eligible to work at the clinics. If you experience any problems with this online training, please contact the help desk before attempting to complete the post-test 3 times. Email schoolflu.helpdesk@doh.hawaii.gov or call 808-586-8300 or toll-free at 1-800-933-4832, Monday through Friday from 7:45 a.m. to 4:30 p.m., excluding state and federal holidays. Let's begin with some background information on influenza and Hawaii's Stop Flu at School program. Influenza disease and the complications resulting from influenza disease place a heavy burden on the healthcare system. Each year in the U.S., influenza disease results in millions of doctor's visits and thousands of hospitalizations and deaths. The number of seasonal influenza-associated deaths varies from year to year because flu seasons are unpredictable and often fluctuate in length and severity. Children are a population who can easily catch and spread infections. Not only high-risk children are affected, healthy children are also susceptible to flu infection, and in extreme cases, even death may occur. The table that you see here represents data from September 2010 to August 2011. During that time, 115 influenza-associated pediatric deaths were reported in the United States. A large percentage of them were 5 years and older, which includes the ages of those eligible for the Stop Flu at School program. Certain conditions put children at high risk for having severe complications from the flu, but even healthy children are at risk. Data here illustrates that nearly half of the 115 children that died from influenza in the specified time frame were previously healthy children without high-risk medical conditions. Flu doesn't only affect sick or high-risk kids. Healthy children also become very ill or even die from the flu. While no vaccine is 100% effective, the single best way to prevent influenza is to get vaccinated each year. Vaccinations not only protect the individual, but may also prevent disease transmission to family members and to the community. Through the Stop Flu at School program, school children in Hawaii are being offered free flu vaccine. Here are some reasons why. The State Department of Health believes that the Stop Flu at School program will greatly contribute to the health of Hawaii's school children, families, and communities. School children generally have very high rates of influenza illness. School children vaccinated against influenza have fewer illnesses, fewer absences from school, and lower rates of illness in their families during the flu season compared with unvaccinated children. Children are one of the most common sources of influenza transmission in the community. The Stop Flu at School program was launched statewide in 2007. Over 65,000 students are vaccinated through this statewide program each year. Flu vaccination clinics are held in participating schools statewide and will operate during normal school hours. Parental consent is required prior to vaccination. Only one clinic will be held per school, with the exception of multi-track schools. There will not be makeup clinics. If a student needs a second dose of flu vaccine, then that student will be referred to his or her doctor. Vaccination clinics will be managed using the Incident Command System, also referred to as ICS. ICS is a management concept that uses an expandable organizational structure to promote efficiency. ICS is used across the nation to manage emergency and non-emergency events. Two main principles of ICS are chain of command and unity of command. Chain of command is a top-down order of authority through which instructions are given and received. Unity of command is the principle that all staff report to and take assignments from only one supervisor. Clinic managers are the lead authority at every clinic. All clinic staff ultimately take orders from the clinic manager, either directly or indirectly through their immediate supervisor, such as the line flow group supervisor or vaccine group supervisor. Each clinic's organizational structure may vary, but every clinic will have a clinic manager to run operations. This slide includes a list of typical ICS supervisory positions at a clinic. Many of these positions will not be used if a clinic is small, and some titles may vary. Chain of command and unity of command will still apply, regardless of clinic size and use of the organizational structure. At Stop Flu at School clinics, the ICS incident commander is the clinic manager. Here is an illustration of a typical ICS command structure. The Stop Flu at School clinic staff may be organized differently depending on various factors. At the clinics, formal information and instruction come from the clinic manager and will be distributed downward through the chain of command. Here is an example of a standard clinic setup. It may vary depending on clinic location and clinic size. Participants will arrive at the entrance and proceed to the registration station, where their consent form will be screened. If the form is complete and no contraindications exist, then the registration staff will direct each participant to the waiting area for either the flu nasal spray or the flu shot. The participant will then go to the appropriate vaccination station, where the vaccinator will administer either the flu nasal spray or the flu shot. Afterwards, each participant must wait 15 minutes in the holding area for observation before exiting. Now let's review the two types of vaccines and various forms used in the clinics. There are two types of flu vaccines used for the Stop Flu at School program. One is the traditional flu shot, also referred to as IIV. It contains inactivated or killed strains of the flu virus that are injected. The other is a flu vaccine nasal spray, or LAIV. It contains live weakened strains of the virus. The following individuals should not receive the flu shot: persons with a severe allergic reaction to a prior dose of influenza vaccine or to a vaccine component such as eggs, persons with a history of Guillain-Barré syndrome or GBS within 6 weeks of a previous influenza vaccination, and persons with a moderate or severe acute illness. There are two types of student consent forms. One is for IIV and one is for LAIV. In most circumstances, the student consent forms will be color-coded. However, some may have been completed online and printed out. These may be white or another color. Please pay special attention and screen all forms carefully so that the participant receives the appropriate vaccine type. On this slide, you can see an example of the flu shot form, which is green. The mandatory fields are circled in red. These include first and last name, date of birth, questions 1, 2, and 3, and signature and date. The following video demonstrates the registration station staff reviewing a consent form for the flu shot.
On the flu shot form, check for first and last name and date of birth. Questions 1, 2, and 3 must be marked no, and the form must be signed and dated.
The following people should not receive the flu nasal spray: persons who are less than 2 years of age or 50 years and older, persons with a severe allergy to eggs or other vaccine components, those who have experienced a severe allergic reaction to a previous dose of influenza vaccine, those with a history of Guillain-Barré syndrome, persons with chronic medical conditions, persons with a history of wheezing or asthma, persons with immunosuppression, those who live with or have close contact with anyone with a severely weakened immune system, persons 18 years of age or younger taking aspirin or aspirin-containing medication, those taking prescription medication to prevent or treat influenza, persons who have received a live virus vaccine such as MMR or varicella within 4 weeks of receiving LAIV, persons with nasal congestion if severe enough to impede delivery of vaccine, pregnant women, and those with a moderate or severe acute illness with or without fever. This is an example of the nasal spray consent form, which is typically yellow. Forms completed online will be another color. The mandatory fields are circled in red. These include first and last name, date of birth, questions 1 through 8, and signature and date. The following video demonstrates clinic staff reviewing the flu nasal spray form.
On the flu nasal spray form, there must be a first and last name and date of birth. Questions 1 through 8 must be marked no. All forms must be signed and dated.
Pictured here are the student IIV and LAIV consent forms that are available online. The flu shot or IIV form has fewer questions and a syringe icon located in the bottom right corner. The flu nasal spray or LAIV form has more questions and does not have an icon. Please screen these documents carefully as they are more difficult to distinguish between than the color-coded versions. Depending on availability of vaccines, school faculty and staff may be vaccinated through the Stop Flu at School program. All adult participants will complete their consent forms online. They will print and sign their forms and return them to their school. The color of the adult consent forms will vary, but the majority will be printed on white paper. There are 2 versions of the adult form, one for the flu shot, which is IIV, and one for the flu nasal spray, which is LAIV. The following videos will describe both forms.
Here is a sample of the adult flu shot consent form. This form will be completed online and printed out. Check for first and last name and date of birth. Questions 1, 2, and 3 must be answered no, and the form must be signed and dated. On the adult flu nasal spray form, mandatory fields include first and last name and date of birth. This form has 10 questions. Question 10 is relevant for female participants only, in reference to pregnancy. In order to be eligible to receive the flu nasal spray, all participants must be under the age of 50. If the participant is female, then questions 1 through 10 must be answered no. If the participant is male, then questions 1 through 9 must be answered no, and question 10 can be left blank. The form must be signed and dated.
After receiving the vaccine, student participants must receive a notification form to take home to their parent or guardian, who can then provide it to their child's doctor so that the immunization record can be updated. If the child received the vaccine, then the vaccine type is indicated. However, if they brought a consent form to the clinic but did not receive the vaccine, then the reason for not receiving the vaccine is indicated instead. There are multiple roles and assignments to be filled by clinic staff, and each has different responsibilities, but there are some general duties that are the same for all staff. Please allow ample time for transportation, parking, and finding the clinic site. All staff must be in the clinic and ready to start their job on time. Those who are late repeatedly will be removed from the roster. All staff must sign in. Clinic staff will receive a job action sheet that outlines a description of your job duties. Read this and attend the just-in-time training provided at the clinic site. just-in-time training will be a brief refresher of important information and updates immediately before clinic. Staff will assist with clinic setup and then perform job duties as assigned. When clinic has ended, staff will assist with breakdown. Before leaving, make sure to sign out. All staff are accounted for through the attendance sheets, so signing in and out is very important. While working at the clinic, please act professionally and courteously. Dress appropriately and wear covered shoes. Bring your ID. Cell phones and other electronic devices are not to be used during the clinic. Bring bottled water and/or snacks in the event that there is a break. However, eating and drinking are not permitted when the clinic is in operation. The following slides describe the roles and responsibilities of the screeners at the registration station and the line flow staff. Registration staff and the line flow consultants report 30 minutes prior to clinic start time. Those who are fulfilling job duties of the registration station must check in with the clinic manager, sign in on the school flu clinic form, receive their job assignment and review their job action sheet, and obtain just-in-time training from the clinic manager. They will also assist in clinic setup. Registration station duties include screening the consent forms for contraindications and completeness, providing the parent-guardian notification form, and directing participants to either the LAIV or IIV waiting area. All registration staff should report any issues or apprehensive participants to the clinic manager through the chain of command. The registration station may have a group supervisor whose responsibilities include problem solving with registration staff regarding incomplete or inappropriately completed consent forms, such as an obvious error in birth date. If further clarification on consent forms is needed, the group supervisor will verify with the clinic manager. The group supervisor will ensure that the registration station has enough supplies and will inform the logistics section chief or clinic manager if additional supplies are needed or if there are any issues regarding clinic personnel. Screeners at the registration station will match the name on the consent form with the participant to be vaccinated. Students must have name badges. If a student does not have a name badge, ask the teacher to verify the student's identity. Inform the group supervisor if students come to clinic without name badges. Screeners will review the consent forms for contraindications, accuracy, and completeness. They will check that the form is signed and dated. When screening the flu shot consent form, if questions 1, 2, and 3 are all marked no and the consent form is signed and dated, then refer the participant to the IIV vaccination station waiting area. If any question is marked yes or left blank, refer the participant to the group supervisor or the clinic manager. If the student reports that he or she has already received the vaccine or should receive the alternate type of vaccine, refer the student to the group supervisor or the clinic manager. When screening the flu nasal spray consent form, if questions 1 through 8 are all answered no and the form has been signed and dated, then refer the participant to the LAIV vaccination station waiting area. Please note that question 4 has 2 parts. Both must be answered no. If any question is answered yes or left blank, refer the participant to the group supervisor or the clinic manager. If the student reports that he or she has already received the vaccine or should receive the alternate type of vaccine, refer the student to the group supervisor or the clinic manager. If a student presents with both consent forms, refer that student to the group supervisor or clinic manager. Each student will receive a notification form to give to their parent or guardian. It informs the parent or guardian that their child was or was not vaccinated. On this form, the screener will enter the student's name and the clinic date. The child will then take the form with them to the vaccination station. LimeFlow staff keep the clinic moving in a smooth and efficient manner. LimeFlow staff have the following responsibilities. They will direct participants to the proper station by checking the participant's consent form for shot or nasal spray. They will monitor participants in the vaccination waiting areas. They will maintain the flow of the clinic, which includes redirecting participants to the proper station if they are found wandering, investigate backups and take corrective action, and consult with the LimeFlow group supervisor or clinic manager as needed regarding flow and personnel issues. The LimeFlow staff may have a group supervisor. This person's duties include the following: monitor staff stations and identify LimeFlow issues, adjust LimeFlow staff as needed, investigate backups and take corrective action, and consult with the section chief or clinic manager as needed regarding flow and personnel issues. The LimeFlow group supervisor will also assist with directing participants to the proper stations and maintaining the flow of the clinic. After vaccination, participants must wait for 15 minutes in the observation area. LimeFlow personnel should be actively monitoring this area and watching for signs of an adverse reaction. Participants in the observation area must be seated. This will reduce injury if fainting occurs. If a participant experiences any adverse reaction, contact the group supervisor or clinic manager immediately. When the clinic is over, all registration staff will assist in cleanup, including the packing of supplies. Please note that personnel who have not received bloodborne pathogen training will not handle any potentially infectious material, such as hazardous waste containers and syringes. Once the clinic has been returned to its original condition, staff must sign out. In most cases, someone will be designated to return supplies to the Department of Health. Whoever is assigned to return supplies and vaccines must do so in a timely and secure manner. The following slides describe the roles and responsibilities of vaccine administrators. Vaccine administrators, also referred to as vaccinators, must meet certain requirements. These include reviewing and understanding the standing orders for vaccine administration and the management of acute adverse reactions to vaccines. Vaccinators must be certified in CPR, must have received bloodborne pathogen training within the past 12 months, and must have experience in administering both intramuscular injections and intranasal vaccine to adults and/or children within the past 12 months. Vaccinators must have evidence of one of the following: proper immunization documentation of 3 valid hepatitis B vaccine doses, documentation of hepatitis B immunity by serological testing, or documentation of refusal of hepatitis B vaccination. Vaccinators must arrive 30 minutes prior to clinic start time. Report to the clinic manager and sign in. You will receive your vaccinator identification code. You will document this ID code on each consent form after you vaccinate each participant. The clinic manager will assign vaccinators a specific assignment within the vaccination station. Review your job action sheet and review and understand the standing orders before performing your job duties. The clinic manager will provide just-in-time training, and you will assist with clinic setup. The vaccination group may have an assigned supervisor or team leader. This person will oversee the vaccine administration area. This includes supplying vaccines to vaccination stations as needed, keeping the logistics section chief or clinic manager informed of supply levels and needs, maintaining the vaccine cold chain, and ensuring the appropriate amount of vaccine is drawn from each vial, which is 10 doses. The vaccination group supervisor will ensure that vaccinators are reviewing forms carefully and administering the appropriate vaccine to participants. The vaccination group supervisor will inform the clinic manager if there are concerns regarding inappropriate vaccine administration. He or she will also ensure that all hazardous materials are attended to and monitored by clinic staff and not easily accessible to non-clinic personnel. All vaccinators must review, understand, and adhere to the standing orders for IIV, LAIV, and the management of acute adverse reactions to vaccines. Gloves must be worn if the vaccinator has open lesions on his or her hands, or if he or she is likely to come into contact with potentially infectious body fluids. If gloves are worn, they must be changed between each patient. Remember that all vaccinators must wash hands or use hand sanitizer between patients. If gloves are worn, remove them after each patient. Use hand sanitizer prior to putting on a new pair of gloves. At the vaccination station, there will be two sets of vaccinators. One group will administer the flu shot, or IIV, and the other group will administer the flu nasal spray, or LAIV. For those administering the flu shot, all vaccinators must review each consent form before administering vaccine to ensure that all participants are receiving the correct vaccine type and that no contraindications exist. One key to preventing serious adverse reactions to vaccines is screening for contraindications and precautions. Do not skip this step. Ensure that the participant is to receive the flu shot. Match the name on the consent form with the participant to be vaccinated. The flu shot, or IIV, consent form has 3 questions. They must be answered no. If any question is answered yes or left blank, do not administer IIV. Refer the participant to the group supervisor or clinic manager. Check that the consent form is signed and dated. If any contraindications exist or the consent form is incomplete, do not administer vaccine. Refer the participant to the group supervisor or clinic manager. If a student reports that he or she has already received the vaccine or should receive the alternate type of vaccine, refer that student to the group supervisor or clinic manager. If no contraindications exist and the form is signed and dated by the parent or guardian, administer IIV following the standing orders. IIV is administered via intramuscular injection. Stretch the skin taut and inject the needle at a 90-degree angle into the muscle tissue below the dermis and subcutaneous tissue. Before vaccinating each patient, clean hands by washing or using hand sanitizer. Clean the administration site with an alcohol prep pad. Administer 0.5 milliliter dose of IIV vaccine intramuscularly into the deltoid muscle. Dispose of all vaccine vials and syringes into the sharps container. Document administration of IIV on the consent form. When documenting administration of IIV on the consent form, record the date and vaccination site using RA for right arm and LA for left arm. You may use pre-printed stickers that have the lot number, manufacturer, expiration date, and Vaccine Information Statement, or VIS publication date, printed on them. Please make sure that the lot number and sticker match. Affix the sticker to the consent form and record your assigned vaccinator identification code.
Let's demonstrate the documentation process for the student flu shot form. Once vaccine administration is complete, record the date and indicate the vaccination site as either the left or right arm. Affix the pre-printed label onto the form. Once the label is applied, record your assigned vaccinator ID code.
After documenting IIV administration, retain all consent forms. These must be collected and returned to the Department of Health. The students will take home the parent-guardian notification form. Complete this document and give it to the students. Adult participants do not receive any forms to take with them. If incentives, such as stamps or stickers, are available, then provide them to the students. Direct all participants to the holding area. They should remain there for 15 minutes for observation. For those who are administering the flu nasal spray, or LAIV, review each consent form before administering vaccine to ensure that all participants are receiving the correct vaccine type and that no contraindications exist. One key to preventing serious adverse reactions to vaccines is screening for contraindications and precautions. Do not skip this step. Ensure that the participant is to be vaccinated with the flu nasal spray. Match the name on the consent form with the participant to be vaccinated. Screen the flu nasal spray consent form for contraindications. The student form has 8 questions. All of these questions must be answered no. The adult consent form has 10 questions. If the participant is female, then questions 1 through 10 must be answered no. If the participant is male, then questions 1 through 9 must be answered no. If any questions are answered yes or left incomplete on the student or adult consent forms, do not administer the vaccine and refer the participant to the group supervisor or clinic manager. Check that the form is signed and dated. If any contraindications exist, or if the consent form is incomplete, do not administer vaccine. Refer the participant to the group supervisor or clinic manager. If a student reports that he or she has already received the vaccine or should receive the alternate type of vaccine, refer the student to the group supervisor or clinic manager. If no contraindications exist and the form is signed and dated by the parent or guardian, administer LAIV following standing orders. Before vaccinating each patient, clean hands by washing or using hand sanitizer. Administer 0.1 milliliter of LAIV vaccine, which is half of the total sprayer contents, into each nostril. Dispose of all nasal sprayers into the sharps container, and document administration of LAIV on the consent form. When administering LAIV, first remove the rubber tip protector. Make sure that the participant is in an upright position. Place the tip just inside the nostril and rapidly depress the plunger. There is a dose divider clip that will prevent you from administering more than half of the total sprayer contents. Pinch and remove the dose divider clip from the plunger. Place the tip inside the other nostril and rapidly depress. It is important that you don't depress the plunger too slowly. If you do, then the vaccine will not mist. If the vaccine recipient sneezes after administration of LAIV, do not repeat the dose.
There are 6 steps in the administration process for FluMist. Step 1. Check the expiration date. Hold the applicator barrel between your thumb and forefinger while you examine the applicator for expected color, clarity, sediment, and expiration date as described in the package insert. Do not roll the sprayer in the palms of your hands. This can cause the dose divider clip to separate from the sprayer. In addition, do not depress the plunger yet. This will cause vaccine to leak out from the applicator and an incorrect dose to be administered to the patient. Step 2. Remove the rubber tip protector from the end of the sprayer. FluMist should not be injected or outfitted with a needle. Tell your patient to breathe normally. They do not need to actively inhale or sniff FluMist. Administration of FluMist does not require any special action on the part of the individual being vaccinated. For young or apprehensive children, it is advisable to provide some support of the head to avoid inadvertent jerking. For example, the child might sit on a parent's lap, or you might place your hand on the child's head. Step 3. While the patient is in an upright position with head tilted back, place the tip just inside the nostril to ensure FluMist is delivered into the nose. Step 4. Depress the plunger as rapidly as possible until the dose divider clip prevents you from going further. If you push the plunger slowly, no mist is created. To achieve the necessary fine mist, you must push the plunger rapidly. Step 5. Pinch and remove the dose divider clip from the plunger and discard it. Step 6. Place the tip of the sprayer just inside the other nostril and rapidly depress the plunger to deliver the remaining half of the vaccine. Of the total dose of 0.2 milliliters for administration, approximately 0.1 milliliter will be administered into each nostril. After administration, dispose of the sprayer in an impenetrable sharps container. Tissues may be provided to the patient following the administration of InfluMist. Let's review again the steps for administering FluMist one more time. Step 1. Remove FluMist from the refrigerator and check the expiration date on the sprayer. Step 2. Remove the tip protector. Step 3. Insert the sprayer into first nostril. Step 4. Rapidly depress the plunger until you are stopped by the dose divider clip. Step 5. Pinch and remove the dose divider clip and discard it. And Step 6. Insert the sprayer into the other nostril and rapidly depress the plunger to deliver the remaining vaccine. Dispose of the used sprayer in an impenetrable sharps container.
Persons who are severely immunocompromised should not administer LAIB. However, other persons at high risk for influenza complications may administer LAIB. This includes persons with underlying medical conditions, placing them at high risk for complications from influenza, pregnant women, persons with asthma, and persons aged 50 years and older. After the administration of LAIB, document the date on the consent form. Indicate the manufacturer, lot number, expiration date, and VIS publication date. If you are using stickers, confirm that the lot number matches the number on the sticker, and place the sticker on the form. Lastly, record your assigned Vaccinator ID code.
Let's review the documentation process for the student nasal spray form. Once vaccine administration is complete, record the date and affix the pre-printed label. Once the label is applied, record your assigned Vaccinator ID code.
After documenting LAIB administration, retain all consent forms. These must be collected and returned to the Department of Health. The students will take home the parent-guardian notification form, complete this document, and give it to the students. Adult participants do not receive any forms to take with them. If incentives, such as stamps or stickers, are available, then provide them to the students. Direct all participants to the holding area. They should remain there for 15 minutes for observation. The following slides will present information about the management of acute adverse reactions to vaccines in a Stop Flu at School clinic. Personnel administering vaccines must be aware that recipients may experience an adverse reaction following immunization, which can be life-threatening. Personnel need to be prepared to recognize and respond immediately and appropriately. Localized reactions to a vaccine are generally the least severe and most frequent. They may include pain, swelling, and redness at the site of injection. This type of reaction generally occurs within a few hours of the injection and is usually mild and self-limited. Sometimes a patient will experience syncope, also known as fainting. To prevent falls in the clinic, assure that the participants sit down post-vaccination and observe them for 15 minutes while they wait in the holding area. Here is a list of syncopal symptoms. It includes fright before vaccination, paleness, sweating, cold hands and feet, nausea, lightheadedness, dizziness, weakness, visual disturbances, loss of consciousness, and falling. If a participant experiences syncope, have them lie flat or sit with their head between their knees for several minutes. Loosen any tight clothing and maintain an open airway. Check their pulse and respirations. Apply cool, damp cloths to the patient's face and neck. If a patient falls, examine them to determine if an injury is present before attempting to move them. Place the patient flat on their back with their feet elevated. If the patient loses consciousness, determine if an injury is present before attempting to move them, and place the patient flat on their back with their feet elevated. Call 911 if the person does not recover immediately or if an injury is present. If syncope develops, the person should be observed until they are asymptomatic. An anaphylactic reaction is caused by an allergy to the vaccine or vaccine components. Though rare, it may be severe and life-threatening. Thorough screening of all consent forms is emphasized throughout this training so that the risk of an adverse reaction is minimized. An allergic reaction usually begins within minutes of vaccine administration, and it requires rapid recognition and treatment to prevent progression to cardiovascular collapse. Please review and be able to recognize the following signs and symptoms associated with anaphylaxis. These include generalized hives, itchiness, redness, or flushing of the skin, swollen lips, face, throat, tongue, and/or uvula, respiratory compromise, gastrointestinal tract symptoms such as abdominal pain, cramping, and/or vomiting, and cardiovascular signs such as reduced blood pressure, syncope, cardiovascular collapse, or hypotonia. An emergency kit will be available at every clinic. It contains supplies and medications necessary to initially treat an individual who experiences an anaphylactic reaction. Kits will include epinephrine, diphenhydramine, needles, alcohol swabs, airways, blood pressure cuffs, and stethoscopes. If a participant experiences an anaphylactic reaction at a clinic, notify the clinic manager. Assess the patient's airway, breathing, circulation, and level of consciousness. If symptoms are generalized, call 911 immediately. Place the patient in a recumbent position and make sure the airway is clear. Perform CPR if necessary. Using the recommended dosage, administer epinephrine and diphenhydramine intramuscularly. To ensure an appropriate and timely response to an anaphylactic reaction, it is critical that you review and understand the standing orders before performing your job duties at a clinic. If an anaphylactic reaction occurs, epinephrine is the first-line treatment. Repeat dosage every 5 to 15 minutes or more frequently as necessary for up to 3 doses, depending on the patient's response. Monitor the patient closely until EMS arrives. Record all vital signs and medications administered. Include time, dosage, response, name of the person who administered medication, and other relevant clinical information. All patients showing signs and symptoms of anaphylaxis, regardless of severity, should be referred to an appropriate medical facility for treatment. This concludes the slideshow presentation of the training program. If you have any questions, email schoolflu.helpdesk@doh.hawaii.gov or call 808-586-8300 or toll free at 1-800-933-4832.